Hi ladies, it's Casey again, coming with my next video for resistance training. So we're going to work again on stretching the chest muscles since we're still pretty tight here. This video is for people who are about 6 to 8 weeks post-op of their mastectomy and reconstruction. So whether you're in spacers or after your permanent implants. So we're going to stretch. We're going to keep stretching the chest muscles, and we're going to work on strengthening the rest of the body. So I hope you enjoy it. It's pretty simple. We're just going to invest in a few pieces of equipment, so it's easy at-home workout. Alright, so as usual, we're going to start with about a 5 to 10 minute warm-up. So you want to get on the bike or walk. And you want your RPE, which is rate of perceived exertion, around 5 on a 1 to 10 scale. So after our warm-up, we start with shoulder shrugs. And make sure that if you're doing this video, you're able to do everything in the first video. So get your shoulder rolls in after that. So we want to do everything about 10 times forward and then back. And we're going to go a little bit more. Bent elbows, 90 degrees. So we're going abduction away from the arms, or away from the body. Okay? Shoulder abduction here. After 10 of these, arm circles. Start small and work bigger. So we're going front first, all the way, take your time, and reverse. Again, start small, just 10. And bigger and bigger. Good. All right, next one. Both hands forward. We're going to clap open, opening that chest. So this is a dynamic warm-up. So after we take your body through the range of motion exercises, we got that blood temperature up from our warm-up, then we're just going to increase the flexibility. So after these dynamic warm-up exercises, we'll do the stretches, the static stretches. 3, 2, last one, 10 rotations. So right here, elbows are 90 degrees, up and down, 10 times. After this one, we'll do right in the center. We're going to do trunk rotations. So this is for anybody who had tram flap or permanent implants, expansions, whatever stage, 6 to 8 weeks, as long as you can do the first video. So 10 of those. And we're going to go work down the body. So find a wall to hold on to. And we have 10 leg swings. Again, you can start small, but this is a good hip opener. 10 front to back, each leg. Go ahead, switch off. And then you want to turn into the wall, and you have 10 side to side. So you can actually do leg swings first thing in the morning if you're ever feeling tight, FYI, because laying in bed, it's going to really bother your back, and it's going to keep your hips tight. So you can do this just to open them up a little bit. Next, we have knee hugs. So you want to hug the knee and hold it into the chest, switching off. So we're doing 10, alternating each leg. And now you're ready for static. Okay, so we're working on strengthening the whole body, but the only thing we're not going to work on strengthening yet is the chest muscles. There can be problems from strengthening chest muscles and developing the pecs because they can actually move the implant and displace it. So you don't want to build your chest muscles yet. You want to wait till about 3 months post permanent implants to really start working on your chest muscles. So for now, if you're getting weekly expansions, you're already tight, so it doesn't make sense to tighten it more by doing any resistance training. So again, use your wall. We did this in the first video, just look away. So I'm getting that stretch all the way through my chest, down my shoulder, and hold each stretch for about 10 to 20 seconds. And switch. So my fingers are pointed away from me, my palm is flat. Good, next chest stretch. So interlock your fingers, just like the stretches in the last video. Chest sticks out, chin is up. So all these muscles, the front, the anterior deltoids, the chest, pec major, pec minor, they're all very tight. So we're just working on stretching those out for now. So after that one, we're gonna go ahead and take the arm overhead and get a little bit of the triceps. Because again, in the shoulders, we might have problems with the rotators, which are the small little muscles. Those get tight, especially when women, their shoulders tend to curve forward, especially after you've had surgery like this. So 10 to 20 seconds each side. Hold that. Good. Last one. Place hands right on your back and look up. All right, now time to get to work. Okay, so I'm starting off with my 5-pound dumbbells. If you're new to exercise or just starting this, you might want to start with 3s. So you can get these at Target or anywhere else, but you want to make sure that you have your feet about hip width apart for all these. It helps take pressure off the lower back. So first one, we're going to do those shoulder abduction away from the body. Again, elbows are 90 degrees. One major thing you want to think about is not dropping the wrists when you bring those arms away from the body. So we have 10, just like that. So we'll start with 10 and then try to get up to work into 3 sets of each exercise. And then as you get comfortable, try to work up to 15 reps of each set for every exercise. Next one, upright rows. So my feet are still about hip width apart. Dumbbells are together. So my elbows are very sharp, and I'm bringing the dumbbells right underneath my chin, up and down. Another thing, always make sure, like I said previously, you don't want the wrist to curl. You want to keep a nice, strong forearm all the way down through the wrist. Okay, so after that set of 10, we have shoulder press. So, elbows 90 degrees, palms facing away from you. And another thing you want to make sure is that you don't grip, like seriously grip your dumbbells too tight, because that causes an unnecessary rise in blood pressure. So you want to kind of keep a soft grip, okay? So we're going to push them up and stop it right there. You don't want to bring them all the way in and then push them up. Right there, even with the shoulders and together at the top. Exhale on the contraction. The contraction is the shortening of the muscle. So as I bring it up, I'm shortening my shoulders and breathing out. So inhale, exhale. Good. So those are your shoulders. Okay, so now we're moving into back exercises. So I have a chair here because I want to make sure I have a nice flat back. So you can have a bench, a chair, use your sofa if you need to, or if you really have to, you could go on the floor and bring it back. You want to make sure you're in a nice tabletop position. But because I have the chair here, we don't really want to get all the way down there just yet. I'm going to go ahead and put my knee on here and my hand. So I have a nice flat back. So you don't want a curved spine. Nice flat back, so you kind of got to stick that butt out a little bit. So I'm going to do it one arm at a time, bringing that elbow up past the body and dropping it back down. So exhale as I bring it up, inhale on the way down. Another variation of this is if you want to, you can turn your palm away or towards your body and bring that elbow out to the side. So either out to the side or alongside the body. Okay, and then go ahead and repeat the other arm and then switch off. Alternate one set on one arm, one set on the other arm. Okay, so next you're going to take both dumbbells and we're going to do a back fly. So what you're going to do is you're going to lean forward. Keep your head always in line with your spine. So my neck is in a neutral position, looking down, I'm not looking up. And I'm just going to squeeze my shoulder blades together. Again, because women are often rolling their shoulders forward, we need to work on those rhomboids, which is right between those shoulder blades. So my elbows are slightly bent, and I'm raising up. Inhale, exhale. This one's going to be probably the hardest one for a lot of women, because a lot of women tend to be very weak back there. So work on that. And if you need to start with an easier way, you can face your palms towards the back of the chair and squeeze those shoulder blades together. So we have 2 variations here again. Palms turned away, and then palms turned towards each other. Now with this one though, look, my elbows are slightly bent the whole time. So they're not straight out. That will put pressure on your elbow. So you want to make sure you're like hugging a tree is what I like to say. So those are 2 back exercises that you definitely need to work on. All right, so moving on down to the smaller muscle groups. So we started with the larger muscle groups. Now we're going to move to the smaller ones. So biceps, you can do palms forward all the way up and down. So you want to make sure that you really, a problem as a trainer that I see a lot of times is people stop short. They stop right here. But you want to let that muscle out all the way because the bicep actually crosses the elbow. So you want to make sure that you get full range with this exercise. So a variation of this would be the hammer curl. Again, my feet are hip width apart if you notice. My knees are slightly bent. Hammer curl, keep those elbows right next to those hips. Lock next to the side and bring them up and down. So another thing that you want to make sure of with bicep curls is you don't want to throw the shoulders into it or your back. I'm not doing this. I'm not swinging my arms forward because that's just momentum. So we want to isolate the biceps. If you need to, again, take that chair and rest your arm right here so it's supported, so you know that you're not cheating. Good. So after you finish your reps for the biceps, we'll go ahead and do triceps. So I want to do it one at a time. We can do tricep extensions like this, but I want to make sure that your back is supported. So just like we did in the back rows, we're going to support ourselves. You want to bring the elbow all the way up, nice flat back, and extend out. So I'm squeezing it out all the way. Another variation for triceps. Go ahead and take a seat. Overhead. Now I'm going to support my arm with my other hand, keeping that shoulder right intact. And we're going to drop that dumbbell behind the back and lift it back up. So remember, breathing out on the contraction. See, it's lengthened here and then it's shortening here of the tricep. So I'm exhaling as I go up for this one. And again, nice strong wrist. Make sure your elbow's not off to the side because that can even hurt you in this position right now. So keep that bicep right next to the ear. Good, go ahead, flip the other side and hold that arm into place. So no flaring elbows out to the side. Good, so we're ready to work with the legs. So, all right, so we're gonna get those legs in shape too. So an easy way to do a squat, because the thing is, you know, I see a lot of people, they squat like this. Now the problem is my knees are going forward past my ankles. So it's really putting a big strain on my patellar tendon. So I want to make sure that I push my butt back. So what I'm going to have you do, hands across the shoulders, sit down and stand up. This way it's going to ensure that those knees are right in line with those ankles. Inhale, exhale, squeeze that butt at the top. Inhale. Okay, so another piece of equipment that you might want to invest in, that we're going to work with in this video, is a stability ball. Now, this is especially good for people that have a hard time getting on and off the floor, or that had the tram flap especially, because my back is supported, so I'm going to show you those ab exercises later in the video. But again, here's another way to do the squats, all squats. So my feet are a little bit forward for this, because I'm going to go down, and look, I can get so much lower with this ball. So make sure you push through the heels, squeeze up. So I'm squeezing that butt. I would say pinch a penny. Pinch a penny with those butt cheeks every time you come up. And exhale, good. So I hope you did your set, because now we're gonna go to the floor. So the squats is a great starter exercises for legs, because it really works all the muscles. So, to the floor, I'm going to go ahead and we're going to work just on that butt. So, we are in a tabletop position. My hips, or my knees are about hip width apart, and my hands are right in line with the shoulders. Okay, so what I'm gonna do is bent knee, lift out to the side. These are called fire hydrants, and I like to call them doggy exercises. You can probably guess why. So we're just gonna lift out to the side. So after you do your set, see with these things that we're not doing a lot weight with, you can start with 15 and work up to 20 to 30 reps of this one exercise. So after I've done my set like this, I'm gonna kick back. So this is really gonna work your butt, and I'm actually keeping my abs engaged right now as well. Good, so go ahead and repeat on the other side. So you can do a couple sets or do all sets or all reps in one set. So either way, I want you to try to get 30 reps. So right now, today, we're just doing 10. Good. Yeah, make sure that chin isn't dropped to your chest. Spine in line. Always think of that. Spine in line, abs engaged. Good. All right. So we're going to do some more Pilates. And this is really going to keep your legs toned and your butt toned. And it's not going to build. That's the most important thing. Is a lot of women don't want to build that part of their body. They just want to tone it. So also, it's good for people with tram flaps. It really works the core as well. Pilates works on the powerhouse from the hips to the top of the ribs. So we're going to go ahead and lay down. You can be up on your forearm or down, a little more relaxed. Point the toe and just draw small circles. So we did it on our backs in the last video. But this time, we're on the side. Again, this is going to work the butt and the thighs. So we'll go reverse and 10 each way. So I'm not rocking my body, keeping my abs engaged, nice and still. And I'm moving that leg. My toe is pointed. So go ahead and do those on the other side. I'm going to show you one more thing for Pilates. So you're going to point the toe, both legs straight this time. Point the toe, bring it in, extend it up, and drop it down. In, up, down. So we're going 10, one direction. When you're done with that, 10 in the other direction. Up, in, out. Up, in, out. All right, so now that my legs are really feeling it, I'm gonna do one more exercise with the ball for my legs. Let me just get it real quick. All right. All right, so I'm gonna go ahead and lay back. And both my feet are on top of this ball. So just my heels. My hands are supporting my lower back as I press it into the mat to start with. Sometimes if you're arched off right here, you can really strain that lower part. So start extended. We inhale, exhale, pull those hips up as you curl that ball toward you. So this is a hamstring exercise. So before we were working inner and outer thigh, we did the quads with the squats. So now we really want to focus on the hamstrings. So inhale, exhale, lift up. Lifting those hips up, curling that ball. If you don't have the ball, then you can use just the floor and just do bridges. And you can even take your toes off to make sure you're really just pushing through those heels, working on that butt and those hamstrings. So, another thing we do is single leg. Push up and come down. So my hands, again, supporting as I come down. So, those of you with the ball, the other option for single leg hamstring curls, curl it in. So notice my leg isn't coming down each time. I'm keeping my foot up towards the ceiling and curling in. So you want, the whole main focus here is also to lift those hips up as high as you can. Because if I'm just doing this, I'm not really getting much work done. So we want to really lift up. So those are our leg exercises for now. And we're about to get into core. So, all right, so I have my ball back and I'm going to go ahead and work on my abs. And And again, this is really good for supporting that lower back, especially if you already have problems. But you know, if you've been in recovery and you've been resting a lot, it's especially good to make sure that your back, you know, gets loose and gets that extra extension. So, because on the floor, we're nice and flat. Here, I'm able to get extension back and then crunch up. But my back is supported the whole time. If I were to do this on the floor, like I showed you earlier, this part of my back would be coming off and it might strain. So inhale down, exhale up. So we're gonna start with 20, okay? Tram flat people might want to only start with 10, okay? And remember, this is 6 to 8 weeks post-op, and everybody's different, so you want to listen to your body. If something's telling you not to do something, then listen to it. Make sure you check with your doctor for everything, okay? So we're going to inhale, exhale. We're isolating now, just the right side. My right hand's on my hips, and I'm crunching up, but over. Inhale, exhale. So after your reps on that side, go ahead, other side. So don't worry if you don't have the ball, because I'm going to show you guys some exercises without it as well. So go ahead, get yourself on the floor. Okay, we're going to start with a simple, like a half bicycle. Not really the full bicycle, but I will show you that as well. So basically I'm going to extend one leg, and my head and neck are already off the floor. Extend one leg. I'm going to bring the knee in as I turn into it with my elbow. So I'm coming back down and across. Bringing that knee in and out. So notice I'm tilting my pelvis into the lower, or the pelvis into the into the mat, and I'm crunching across. So yeah, don't make sure you're not lifting off. Go ahead and repeat the other side. You want to support that lower back and turn over. So another problem I always see is people want to pull their necks, and that's not right. Obviously, we're trying to work on the abdominals. So if you notice that your neck is feeling any strain, that's another reason, a good reason to have the ball. But it also might just mean that your abs are weak and we just need to work on them. So your neck is just trying to compensate for that. Okay, so if you were able to do each single leg and you want to incorporate them, let's go 30 seconds of bicycles. So both feet start off the ground, and we're going to rotate. My head does not come down at all. This is something you will really feel. So try to go for 30 seconds. Okay, 30 seconds, or just count for 20 reps, whichever's easier. And relax. Okay, so everybody's always wanting to work on the lower abs, so I'll show you some exercises for that. We're going to take our hands, place them under our butt so that I'm kind of making like a support with my arms for my lower back. Legs are up, and I'm going to drop them about a foot off the ground. I'm going to tuck my chin up into my chest, and then I'm going to flutter my legs. So my legs are moving up and down, and I'm breathing. Good, take a rest. So another variation you could do for that, look up. The reason I'm looking up is because it will support your lower back. In and out with those legs. Good. All right, so a few more exercises for those abs. We're going to do modified V-ups. So one version is hands behind your back. My fingers can be pointed away or towards whatever's more comfortable. Get out of here. All right, feet in, knees tucked. We're going to exhale, push away. So this is going to get that whole rectus abdominis all the way. Inhale, exhale. So those of you that find this a little easy, hands off the floor. All right, so next I'm going to show you some planks. We're going to do a couple different variations. So first, regular plank. Now, I'm going on my forearms. I'm not going all the way extended. You can if you want. I actually find that it kind of works the abs more to be on your forearms. And when you're like this, it's kind of more shoulders. That's how I see it. So you're gonna be on the balls of your feet, and my butt is not all the way up here, and I'm not dropping my back here. One straight line, head in line with the spine. So you can hold this for a 30 count. Making sure that everything stays straight in line. Don't drop your head. Okay, when you're done with that, we're gonna go into a side plank. So you can stack your feet, it's a little harder, or if you want to start off with one foot behind the other, that's a little easier, okay? Hand on the hip, or you can use it to help you get up. So push off, and then put the hand on the hip. So this one you can hold for 15 seconds. Make it harder, raise that hand, make it even harder, raise that top leg. So a couple variations. And go ahead and repeat on the other side. So, give you a full body workout, pretty simple stuff here, very minimal investment, and something you can do at home. So I hope you enjoy it, and if you have any questions, please check out Foobie Fitness on Facebook and mydestiny/us.com, Lisa's website that I'm a part of with Foobie Fitness. And my name is Casey, and thank you again for checking in.